Good day, class. In this video, we are going to study the infantile indigestion. The infantile indigestion, from the title, we will understand that this disease is related to the digestive function, and especially we refers to kids that's below the age of 5. The reason for this problem is from improper diet, especially improper feeding, because the kids and different causes that result in the dysfunction of spleen and stomach. The dysfunction may due to the improper diet, especially improper feeding from the parents. The improper feeding, such as overfeeding, so in adults, it's very similar to overeating. So the kids were fed through actual food. And also in some other situation, maybe the early discontinuation of milk, especially for human milk. Sometimes it's unbalanced diet. For instance, some kids, they only eat certain food. They don't eat the rest of other food. So after long-term improper feeding, it may result in dysfunction of spleen and stomach. Another common reason for this problem is the parasites, especially in the villages. It's also very common. The parasites in the digestive system also may result in indigestion. The manifestations of this problem, the kids may present as malnutrition, so you'll be very skinny and accompanied with fatigue, stomachache. Main symptoms will be poor appetite, stomachache, abdominal distension, nausea, vomiting, loose stool, or constipation. The common syndromes such as food stagnation, spleen stomach deficiency. So for this problem, because this disease happens in kids and the treatments in pediatrics sometimes is kind of simplified, so we don't have a lot of syndromes and as well as a lot of differentiated diseases. It is very important to recover the digestive function to improve appetite, but in the meantime, it is also very important to find the actual cause or the potential cause of this problem. So the main points we can use room 12, room 25, room 36. Room 12 is the front move point of stomach. Room 12 also the full meeting points. Stomach 36 is the lower C points of the stomach. Stomach 25 is the local point. If this patient doesn't have the symptoms related to the stool or the abdominal problems, you don't have to always at stomach 25. But in the meantime, you also can use the back-through points of the spleen and stomach. Another point that we didn't introduce here is the 室缝. I'm going to write down here. I'm not quite sure in your notes you have this extra point or not, but this point is from experience, very commonly used. You can search on Google where it is 室缝. So it will be in all these fingers in these joints. So just in the center of the joints, okay, in the center. I'm going to mark on my finger. There are 4 points on each hand. So in the center, this one, the center, also here. The technique for these 4 points, So on both hands, we got 8 points. The technique for these points, you're going to use the 3-edge needle to prick and to cause bleeding. But this bleeding, mostly in this situation, you can squeeze out some fluid, especially if you can see some yellowish or gray color fluid from here. Then you can squeeze out until you see you can squeeze out for a few drops, or until you see the blood, and then you can stop. This is also quite effective according to the different practitioners' experience. It is very important that before performing the 3-edge needles, the disinfect technique must be applied. And this technique is quite painful, so you also need to explain to their parents if you want to perform this treatment. Other treatment technique, these are quite similar to the other diseases. The next disease that we are going to discuss is the infantile cerebral palsy. This disease is quite a severe and comprehensive disease. This is especially due to the mother has some infection during the pregnancy or during the process of delivery for some problems, such as the lack of oxygen for the kids, and it results in the damage of the brain. So no matter what kinds of causes, mostly it is due to the lack of oxygen during the pregnancy or during the delivery, before or after the process of delivery, of giving birth. This problem in Chinese medicine, we refer to the kidney. So we refer to the innate problem, the developments, congenital, innate. Patient may present with impairment of extremities, accompanied with the intellectual deterioration, seizures, the hearing problem, the visual problem, and the speech disorder. This problem, no matter from Western medicine or Chinese medicine, including acupuncture, we may see some results, I have to say it's very limited results. But because of the disease, if the patient want to try, we still need to give some treatments for these kids, try to improve the situation of the kids. There are two benefits, at least two benefits for this situation. Firstly, we may use acupuncture to try to improve the mobilities of the kids, to increase the movements of the kids or the speech problem. So try to reduce these severe symptoms. But in the meantime, the treatments also can benefit the family. So from psychological point of view, this is also very important. So for acupuncture, what can we do? Because this problem happens, as will be explained just now, it happens during the process of pregnancy or around, before or after giving birth. So this process is innate. We're going to focus on the kidney. This is the development, the body development, also related to the kidney. So the treatments, we may focus on kidney and spleen. Because of the mind, we can focus on the heart. So these are the common symptoms as we can consider. Apart from the body points that we have introduced here, we're going to support the brain function, the impairments, through meridian. because blue meridian links to the brain directly. Apart from the body points here, we also can use the skull acupuncture. So these I'm not going to go into details. You can go through by yourself. You can use the skull acupuncture technique. We can keep the duration, retain the needle longer, 2 to 4 hours. In the meantime, if these kids can move around, you can keep the needles on the skull. You can ask the kids to play around. So the kids don't have to be seated in there for 2 to 4 hours. They can play around. We actually encourage the kids to move around while the needle is still in. So for this problem, we mainly focus on the symptoms, and in the meantime, we tonify the kidney and spleen, the innate and acquired qi, to strengthen the development of the body. The acupuncture treatment for this problem, we can see some results, especially at the very early stage. So the earlier the better after. So the treatment will be better if applied the treatment earlier, which means the kids is younger. The younger the better. And the duration of the disease, the shorter duration of the disease, we may see a better result. In the meantime, we also need to advise their parents to assist the kids to have some physical exercise, such as the physiotherapy or speech therapy. Thank you for your attention.